Today's Health Watch: ovarian cancer, a silent killer because the signs are hard to recognize.
Local 5's Caitlin Corbett shares with us one Green Bay woman's story of survival.
After a busy holiday season with loved ones, Green Bay grandmother Judy Shea thought she had maybe indulged a little too much after Thanksgiving. But her instinct to get her symptoms checked out led to a more scary diagnosis: ovarian cancer.
But other than that, there was none.
Judy Shea is talking about her symptoms before being diagnosed with ovarian cancer last fall. It's something you often hear people with this diagnosis say. There were none.
It's hard because they're actually symptoms that most women have if they eat something wrong. So it's bloating is a big one. Indigestion is another. Sometimes it's changes in bowel and bladder habits, and sometimes it's abdominal pain. So, and that's the issue with ovarian cancer, is that a lot of those symptoms patients can have on a daily basis.
For Shea, it started with a persistent cough that prompted her to go to urgent care. When a chest x-ray revealed some dark spots near her liver, a follow-up biopsy would confirm stage 3 ovarian cancer. Other than some pain on her right side, Shea didn't know something was wrong.
Like my husband said, disbelief. But for me, I guess I was in kind of a daze. And just, as my mom always used to say, one day at a time. And just kind of have that as your goal to get through to the next and to your final goal.
The first step was chemotherapy, followed by a hysterectomy, all done by her gynecological oncology team at Aurora Baycare.
The surgery itself, when it is ovarian cancer, we do remove what I call the lady parts. So essentially the ovaries, so both of them, the fallopian tubes, the uterus, and the cervix. Sometimes we also remove what's called the omentum. That's this fat pad that goes over everything that can have cancer cells in it. But our bottom line is, if it's got cancer cells on it, we want it gone at the end of the surgery.
Shea is now undergoing immunotherapy to keep the cancer from returning. She has a lot of life left to live, 2 grandchildren to watch grow up. Shea wants other women to know that though the signs may be hard to spot, listen to your body when something feels off.
My advice would be to not ignore anything. If you feel something, say something. You know, the doctors have seen everything. There is nothing to be embarrassed about going to a doctor to ask them. There's nothing wrong. You know, rejoice and celebrate. But if there is, get going on it, and they will help you. They will be there to do their best job to make you, safe and healthy again.
Family history is also important to know as well. To learn more about women's cancer treatment options at Aurora Baycare, request an appointment with a gynecologic cancer specialist. And that's your Health Watch. For Local 5 News, I'm Caitlin Corbett.